Okay, students, let's begin the class. So today we will be revising on the topic of varicose vein. So varicose vein, it comes under what? Abnormalities in the veins. Understand? So this is just a picture showing you the difference between normal veins and varicose veins. So this is the normal vein. So the blood goes in this direction, in the upward direction, and they go towards the heart, so that the circulatory system of the heart will be normal again. But in this varicose vein, you can see that it's not normal. All right. Okay. So this is the varicose vein. Understand? So this is the normal vein. So the blood goes in this direction, in the upward direction. But in the varicose vein, what will you find? You will find that there is since the veins, no, or else the valve, they are weak, or else they are damaged. They used to get damaged. So that's why what will happen? There will be backflow. There will be backflow of the blood. You understand? For that reason, what will happen? There will be blood clot. There will be blood clot. Okay. Okay. So here are a few pictures that is the varicose vein. So the varicose vein, they are what in you can find in what color? You can find that the varicose vein, they are dark purple or else blue in color, and you will find that they are twisted. All right, you will find that they are twisted. Twisted means they all are left together, all are combined together, and sometimes you will feel bulgy also. Bulgy means what, like a little bit puffing out and all that, and the person will feel heavy or else painful also in the varicose vein. And the varicose vein, they are associated or else they are linked with the spider vein. So this is the spider vein. All this, the spider veins, they are like spider webs. All right, they are like spider webs. They are the network of what? They are the network of the blood vessel. Understand? They are the network of blood vessel. Is it clear this portion? And the varicose vein, they mostly affect, they mostly occur in the superficial vein. Understand? Not in the deep veins, they occur in the superficial vein. All right, is it okay? Okay. So these are the few symptoms that you will find in the varicose vein. Sign and symptoms. So this is the sign and symptom. The varicose vein, you will find that they are purple or else blue in color, and they are twisted. All right, they are twisted like this. They all are twisted together, and bulging is coming out or puffing out from from the legs, and uh, they are painful also. Why? Because there is blood clot. Obviously, there are some abnormalities going inside the leg. It's not so that's why it will be painful. Understand? And spider veins, this is a spider vein. Sometimes they occur, I mean, they appear in the face, all this portion also, but they are not that much, what to say, serious. They are not that much harmful. You can say that. So these are some symptoms of the varicose vein. Uh, since there are abnormalities going on in the veins, so the person will feel burning sensation. Understand? There will be muscle cramp. Muscle cramp means contraction of muscles. You will get, there will be contraction, and you will find that there will be swelling also. Right? Sometimes you will feel that the leg will be it will swell. Next is throbbing. Throbbing means the pulse. The sensation means the pulse, which you will feel it won't be normal. It will be very much rapid. It will be very much fast. Next is itching around veins. Means your veins. Alright, means in this portion it will itch. You know the meaning of itch, na? Means खुजली होना, means itching. Okay. Next is discoloration of the varicose vein. Alright, it will be discolor. Means the color will change. The color will change into a purple, dark purple or blue. Right? So it will change into that color. And next is the leg will pain. Alright, the leg will pain as well as the leg. You will feel that the leg will be heavy compared to the normal leg. No? Compared to the normal leg, the affected part, that is the varicose vein portion, it will pain. It will pain as well as it will be heavy. Is it all right? This portion, is it clear?
Sure.
Okay, causes. Why does it occur, this varicose vein? Okay, let's see. Normally, you will see that this is the normal vein. Normally, what will you find? You will find that the blood, no, the blood will move through the veins, and it will go to this direction, upward direction, that is towards your heart, so that blood circulation, right, circulatory system will be in the process. Understand? And these valves, these are the valves that you will find in the vein. These valves, what do? They help in like closing, opening. All right. So when in this normal valves, normal veins, what will happen? Like automatically the valves will open and like it will go to the direction. I mean, upward direction, it will go towards your heart. But in the varicose vein, what will you find? These valves, no? All the valves that you will find in the vein, they don't close properly. Why? Because of the weakness and damage of the of all this vein. Since it is weak, you will find that they don't close properly. So as a result, what will happen? There will be a blood pooling, 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 or else blood pool. Like what will happen there? The blood will accumulate in one particular place. So if the blood will accumulate, or if the blood will pool like together in one particular place, obviously the person will feel pain, not it, and sometimes it will lead to skin ulcers also. Understand? Skin ulcer means inflammation. It's getting burned. It's getting red. It's getting damaged. Understand? So these are the cause of the varicose vein. Is it clear?
Sure.
Okay. So this is another one. I've already explained, so I won't explain again. Okay, so risk factors like who are mostly likely to have this varicose vein, who are at the risk of having this varicose vein. So if there is any blood clot or any like vein damage and all those, so all those person or all those people or all those individuals, they are at the risk of having this varicose vein. All right. And next is like if a person sit or stand or like lie down in one particular place for a longer period of time, for too long, then the person will be at the risk of having this varicose vein. The next is overweight or else obesity. So if a person is like overweight, too much fat, so the person will be so all those individuals, they will be at the risk of having this varicose. Next is pregnancy. So if a person, if a lady or if a woman is like pregnant, so as there is too much weight in her, since there is too much weight in her, so what will happen? Obviously, it won't be able to what to say, it won't be able to carry that weight which is in her, so it will affect the veins. All right, so it will lead to varicose vein. Next is hormonal changes. So hormonal changes, because of some hormonal changes which is within the body, at that time also the person can be at the risk of having this varicose vein. Next is genetics. Like if a person, close relatives they have, father, mother, or anyone who are relatives, like genetics, so they are at the risk of having this varicose vein. Next is aging, like elderly people. Why? Because in elderly people you will find that they are already old, and as a result, what happened? Their veins usually gets weak, all right, and sometimes they tear also. That's why it will lead to varicose vein. Next is a female. The females, they are mostly likely to have this varicose vein because of all these reasons, right? Pregnancy, hormonal changes, all these reasons. Like for all these reasons, the female, they are most likely to have this varicose vein. I hope it's clear.
Yes,
Next,
yes.
okay. Okay, next is complications. What are the complications, or what are the difficulties that a person will face while having this varicose vein? Okay, so first let us see ulcer. So this is ulcer. Because of the weak valves or else the damaged valves, what will happen? The blood, it will accumulate in one particular place, and in that particular place, what will happen? There will be inflammation. Understand? There will be inflammation, and ultimately it will lead to ulcer. All right? It will lead to ulcer mostly near the ankle. So this is your ankle. So it will mostly lie in this particular place. All right? This this one. So this is the ulcer that occurs in due to varicose vein. Okay. Next is blood clot. So in the varicose vein, what will happen? Like there will be clotting of the blood in in this particular place. All right, in this particular place. And this blood clot normally is known as thrombophlebitis. We have already discussed now thrombophlebitis. Yeah. And the next complication is bleeding. The person will have bleeding also. So this is bleeding. It's bleeding inside. So it will appear or it will occur in this manner. All right. So these are some complications that you will find in the varicose vein. So now let's see about the prevention. Okay, first is exercising. So if a person sit or stand in one particular place for too long, what will happen? Obviously, the blood circulation, all right, the blood circulation, it won't be proper. It won't be in the normal process how it usually used to be before. So in order to uh, regain, or else in order to make the blood circulation normally, a person should, what they should do, a person should exercise. All right, a person should exercise. This is exercising. And the next is what? They must see their body weight also. All right, like obesity people, na, who are fat, like, yeah, obesity, overweight people. So they should see their weight also. They have to reduce their weight in order to prevent themselves, or else in order to avoid themselves from not getting this varicose vein. Okay. Next is they should maintain their diet also, like they should have high fiber foods also. All right, high fiber foods, they mostly help us in constipation, as well as they also helps in maintaining our weight as well. All right, fiber foods. Okay, so fiber foods you will find oats, spinach, potatoes, strawberries, wheat bix. Wheat bix is a grain. Lentils. Lentils are dal and all that. Okay, almonds, banana, orange, corn, all this. Chickpeas, chana, no? All this they contains high fiber. So in all these foods, you will get fibers which will prevent yourself, or else which will help yourself from maintaining your weight. Okay, next is low sodium choice. Like the person should have low sodium foods like salty food, right? All this, all this the person should have, which have who have low sodium like what to say, thing. Fruits, vegetables, grains, meat, fish, poultry, beans, all this, and dairy, flavors, all this the person should have. Okay, and the woman, mostly females, they should avoid heels. All right, why heel? Because when a person or when a lady wear heels, they used to give pressure. It's not it, and it's difficult also to wear heels. So since they used to give pressure in that area, so what will happen? The veins it will get affected as well as the blood circulation also, like it will hamper. So that's why it will affect. So that's why the person or else they should minimize themselves from like wearing heels. Okay, next is keep your legs elevated in this manner. Why? Because if we keep our legs elevated in this manner, it helps us in what? Circulation of the blood. Okay, it helps us in circulation of the blood. So uh, a person should have performed in this manner. Okay, is it clear? Is it clear about varicose vein, everyone? Okay. Okay. If it is clear, then Haboklan, can you hear me?
Yes, ma'am.
Okay. Can you please turn on your video? Are you having some network issues? Haboklan?
No, ma'am.
Okay. I can't see you, but okay then. It's okay. Fine. No problem. Okay. You just tell me which part of the vein is mostly affected in the varicose vein? Is it superficial vein or deep vein?
Superficial.
Superficial veins, no? Okay. Okay, good. Okay, next question goes to Darshana.
Yes.
Can you please turn on your video, Darshana?
Can you
Okay,
please repeat,
Darshana,
ma'am?
tell me some of the symptoms of varicose vein. What are the
Symptoms of
varicose vein? What are the changes in
burning,
burning? Okay, anything else?
muscle cramping,
Okay, some
swelling
more.
in the lower leg,
Okay, okay, good.
swelling in the lower leg.
Okay, good. Okay, you can turn off your video. Next, Virginia,
Yes, ma'am.
please turn on your video, Virginia. Okay, Virginia, please tell me some of the symptoms. You continue what Darshana said, but don't repeat the same thing, whatever she said.
Symptoms of varicose vein, ma'am.
Yes, yes.
Burning,
I think she already repeated that.
Muscles cramping,
I think that one also she repeated.
uh, itching, itching around vein,
Itching. Okay. Itching in that particular area. Itching in that
itching
affected area.
around
Okay.
vein,
Okay. Anything else?
then itching or heavier in leg, and the leg will feel pain.
Okay. Heaviness. Right. Okay.
Yes, ma'am.
Okay. Okay. Good. You can turn off your video. Okay. Next, Jam Nunu.
Yes, ma'am.
Okay. Can you tell me causes of varicose vein? Please turn on your video.
Yes, ma'am.
Turn on your video. अपना वीडियो ऑन करो. अच्छा.
मैम ऑन कर दिया.
Tell me some of the causes of varicose vein. हाँ, causes बोलो. वेरिकोस वेन का क्या क्या कॉजेस, मतलब किस वजह से ये वेरिकोस वेन होता है? उसका क्या कारण है? कुछ रीजन होगा ना ये तो नॉर्मल नहीं है कि नहीं?
हाँ मैम.
हाँ, तो उसका कॉजेस क्या होगा? वो वेन्स 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 को क्या हो गया कि ऐसे हो गया? वेन्स को क्या हो गया? हाँ जैम, वीक है कि नहीं? कमजोर हो गया इसलिए ऐसे हो रहा है कि नहीं जैम?
यस मैम.
हाँ, तो बोलो मतलब ये तो ज्यादातर वीक वेन्स से होता है या फिर डैमेज वेन्स से होता है, कॉजेस है उसका. ठीक है, समझ में आया जैम? हेलो हेलो, समझ में आया? डिड यू अंडरस्टैंड? ओके ओके, नेक्स्ट हेमम शैली देवी.
मैम.
ओके, प्लीज टर्न ऑन योर वीडियो. Okay, Hemam Shelly, please tell me some of the risk factors of varicose vein. Who are most likely to
मैम
have
बाय
this?
एस.
Uh-huh. Age,
All एस.
old age,
All एस
okay,
people.
elderly people, okay. Some more?
मैम जो जो टाइट ड्रेस पहनता है,
Tight dress,
हाई हील्स,
okay,
हाई हील्स भी,
okay.
और
Okay, मतलब क्यों होता है ऐसे? Why if a person wears tight clothing or else tight, sorry, heels, why it happens?
ब्लड फ्लो में उसका ब्लड ठीक से फ्लो नहीं करता जो टाइट ड्रेस पहनते हैं.
Okay, blood circulation proper नहीं होता है ना?
हम्म.
अच्छा, okay. Okay, good. Okay, next, Ilashra. Okay, please turn on your video. Okay, can you please continue some of the risk factors?
Factors.
She said wearing high heels, tight clothing, and elderly people.
Being
Uh-huh.
the sitting or standing
Okay, sitting or standing for too long. Okay.
overweight,
Okay, overweight, obesity,
uh, pregnancy
pregnancy. Okay.
changes,
What changes?
gen- changes,
What changes?
and
I mean,
genetics changes.
what will change? Means
Hormone
okay, hormonal changes.
genetics.
Okay, genetics. Okay, okay, good. Okay, next, Ishan. Please turn on your video. Hello. Can you hear me, Ishan?
Yes, ma'am.
Okay, have you turn on your video? I can't see you. Okay, okay, I saw you. Okay, can you tell me some of the complications of varicose vein? Ulcer, okay,
Blood clot,
blood clot, and the last one, bleeding.
bleeding.
Okay,
Yes, ma'am.
okay, good. Okay, next, why come?
Yes, ma'am.
Okay, please turn on your video. Okay, why come? Can you please tell me some preventive measures in varicose vein?
Mm, Ma'am, exercising,
Huh? And anything else?
body weight.
They should maintain the body weight. Okay,
Yes, ma'am.
okay. Okay, next, good. Okay, next, Nafishisha.
Yes, ma'am.
Can you please turn on your video? Okay, Nafishisha, anything else apart from those 2 points? She said maintaining body weight and exercise. Anything else from your side?
Elevating the legs, changing the sitting and standing position regularly,
Okay,
and also avoiding high heels, wearing of tight uh, pants and socks.
okay, okay, good. Okay, next, Senkamshi, can you hear me? Senkamchi. Yeah. Okay. Sheetal, can you hear me?
Yes, yes.
Okay. Can you please turn on your video? Okay. Can you please tell me what kind of food a person should have who are having varicose vein? What
Low fibrous.
low, low or high?
Hi.
Fiber foods, no? So can you tell me some
Uh,
examples of fiber foods?
chana, beans,
Don't say chana, okay? Chana, I have just said like for you all to make you understand. You say chickpeas, understand?
yes, yes.
Chickpeas. It's called chickpeas, not chana. Okay. Anything else?
Beans.
Okay, beans.
Mm,
Lentils and all also I said, na? Chana,
ma'am,
sorry, not chana,
here,
dal. Uh-huh.
dal,
What?
dal,
I didn't get what. Can you please pronounce a bit clearly?
dal, ma'am, dal.
Oh, lentils. It's called lentils. Okay. Okay. And they should have low sodium sodium foods. Listen, low
Ma'am,
sodium, not high sodium. High fiber foods, low sodium. Did you get?
yes, yes, ma'am.
Okay. Okay, good. Okay, I hope you all understood na, today's class.
Yes.
Varicose vein. Okay. Okay, then that's all for today's class.